Brittany, for doing the initial blessing. I really appreciated those words from you. So I just wanted to give everyone an overview of what we were going to be talking about today. So as Patrice had mentioned, the topic today is going to be tribal suicide prevention codes and taking a community-based approach to that topic. And we came to this topic in thinking about how there are so many issues that underlie suicide in Indian country. And some of the tribal codes that are in existence address these issues, such as maybe family violence, child abuse or neglect, unemployment, but there are very few codes that are actually out there specifically for tribal suicide prevention. And so today we're going to take a look at how fostering partnerships of local community leaders, and approaching, tribal code creation or revision that way, people can be empowered to identify some local problems and take more of an active role in devising and implementing some local solutions. So the objectives today are to encourage tribes to review and revise as well as enforce suicide prevention statutes, to understand the importance of community-based code development, and to familiarize tribes and each other with resources and tools that are available to assist in revising or developing statutes or codes. And as I mentioned, there are very few tribal suicide prevention codes that actually do exist, and there seems to be a misconception out there that tribal communities don't have the resources to draft their own codes, or maybe they don't sort of have the internal capacity around that. And this may result in the adoption of state codes or the adoption of other tribal codes that may or may not fit with the particular tribal community, codes that aren't relevant to the community's history, culture, tradition, or geography, or codes where there's no buy-in from the community. And so as a result, you end up with a fit that is far from ideal, I would say. So today we have 4 presenters I'm about to introduce, and they're all very accomplished and bring really different perspectives to the table in talking about different aspects of partnerships and thinking about working together around creating or revising codes in your communities as they pertain to suicide prevention. And I just want to say up front that they are 4 very accomplished women. I have completely scaled back their biographies, so just know that I'm giving you a small snapshot of their different accomplishments because they really, they do have quite a bit of experience under their belt. So I'd like to start off with Cora Whiteman. She is an enrolled member of Spirit Lake Nation and serves as coordinator for the Oconee Oitika Strong Life Suicide Prevention Project. She has over 30 years experience in administration and has been actively involved in a range of initiatives throughout the Spirit Lake Reservation. The goals of the Strong Life Project in particular are aligned with her personal mission to save lives on the Spirit Lake Nation. We've also got with us Francine Larzalier Hinton. She's a member of the White Mountain Apache Tribe and has held the position of NARCH Director, NARCH Director with White Mountain Apache Tribe and Johns Hopkins Center for American Indian Health since 2004. And this position has allowed her to be both researcher and administrator, and her current research focuses on suicide prevention among the White Mountain Apache people. She strives to promote health research in Native communities through community awareness, education, and involvement. And co-presenting with Francine is Novaline Goklish, who is also a member of the White Mountain Apache Tribe. Ms. Goklish has worked as a behavioral interventionist for Johns Hopkins and the White Mountain Apache Tribe for over 15 years. She oversees day-to-day activities of natural helpers and facilitates local community advisory board meetings and elders council activities. She's also the center's primary liaison to the Tribal Council and the Tribal Health Board. And last but not least, we have Eleanor Nault, who is an enrolled member of the Chippewa Cree tribe and was appointed by Montana Governor Brian Schweitzer to serve as Montana Board of Crime Youth Justice Council for a term ending in 2014. Since 1995, she's worked as an administrator within various organizations that provide education, judicial services, crime prevention, substance abuse prevention, and intervention services and strategies. Eleanor served as the tribe's court administrator for 7 years and the Juvenile Detention Alternatives Initiative director for 4 years. So I would like to warmly welcome all 4 of our presenters.
Wonderful. Thank you, Gail. Cora?
Yes.
Would you like to go ahead and discuss the Wachona Wahika Strong Life Project?
Yes. The Spirit Lake, the Wachona Wahika is a youth suicide prevention project. It's a culturally enriched approach to youth suicide prevention, and it's based on our culture, language, values, and history of the Spirit Lake Dakota Mini Wakan Oyate. It's promoting positive self-identity, increased self-esteem, and increased knowledge of Dakota way of life. And our 4 goals are to increase awareness of suicide, its risk factors, protective factors, and suicide prevention, increased identification of youth at risk, referral to appropriate resources and follow-up, increased youth, family, and community engagement, effective and efficient program implementation, and sustainability. Our staff consists of 1 director, a part-time director at 25%, and 1 coordinator, which is myself, full-time. And we do have 2 youth prevention specialists on staff full-time, and we do have 1 that will be filled this week. And we have a part-time case manager and a part-time student assistant. So we are a very small group. But what I'd like to mention here is the nationally, Native American adolescents have higher rates of suicide than other groups. Rates of suicide in communities across the northern border of the United States are among the highest. The Aberdeen area in which Spirit Lake resides has the 2nd highest rate, 19.1 per 100,000, compared with all Indian Health Service areas and the U.S. rate. Suicide is the 2nd leading cause of death among American Indians and Alaska Natives in the 15 through 34 age group. In the Northern Plains region, suicide has a 3rd leading cause of injury or death. That was in 2005 to 2006. Young people in the age group of 15 to 24 had the highest suicide rate. The next group was the 25 to 34, is close behind. In the Aberdeen area, females attempt suicide more often than males. That's some data for Wachona Wahika.
Cora, you actually have a really kind of key project that you guys have been working on with your coalition and really coordinating some policy changes with their nearby hospital. Can you talk a little bit about that?
Okay. That is with the what we have is the Suicide Prevention Coalition members that that develop a suicide prevention protocol. And the partners in that are the Spirit Lake Health Center, the BIA Law Enforcement, the Spirit Lake Tribal and Associate Judges, the Youth Intake Officer, which is a new position, Tribal Health, the Lake Region Human Services Center, Spirit Lake Tribal Court, Youth Healing and Wellness Centers, area school counselors and administrators, local ministers and spiritual leaders, substance abuse prevention and treatment programs, violence prevention programs, and community members. Those are members on the coalition. And what the coalition has been working on is working with the community, the programs that, like the Mercy Hospital that you mentioned. We have a very one of our key partners in here is the Lake Region Human Services, and that's Doug Botnick, and he's a very important partner here. He's very knowledgeable of the outside, because he is located off the reservation, and he works with the State Department, all the federal departments, and all that information that he provides to us is key to what the coalition puts together. Because we are located on a reservation, it's mainly the reservation will just deal with what we can do on the reservation, but when it comes to the outside in that area, Doug and Pat Conway, our evaluator, play a big part. Well, not only that, but the other programs also. So these are key partners. But to get back to the hospitals, there's protocol there that that they had provided, or my mind just went blank here. But the crisis response plan has been used through the local law enforcement. If there was a suicide completion or an attempt, they followed a protocol. So it's we have all these key partners. So then that really helps with completing a person at risk or attempting, or the ideations. And there's been a lot of instances on the reservation here that not only pertain to the suicide attempts or ideations, but the protocol played a big part in that, in going from the reservation to off the reservation to transferring to a hospital. The reservation here does not have a hospital, so we have to send them off the reservation.
Okay, great. And was it didn't also that protocol institute or bring about the change of having a tribal member on the board for the Mercy Hospital in Devil's Lake?
We have, there was a lot of turnover here with our tribal council. So, but we do have one of the council members now was a former vice president here at the college, a representative. We have 4 council representatives from each district from our reservation, and 2 of the representatives are from the college here. They transferred they're elected into council. So I think that'll play a big part in our protocol, because it was going nowhere there for a while.
Yeah. Okay. Great. And what I just wanted to reference or reiterate that if you have questions for the presenters, such as Cora, we will be taking questions and answers at the end of the presentation, as to give the presenters enough time in order to present their materials. So if you do have questions for Cora, please write them down or put them into the chat, and we'll bring those up at the end of the presenter's presentation. So Cora, thank you so much in regards to sharing what Spirit Lake Nation is doing and how the how the protocols developed by your coalition has really kind of made some inroads in regards to the hospital in the neighboring town, and how you guys are just really moving forward to really ensure that the efforts that you are doing will continue to live on. So, Novaline and Francine, you want to talk about the surveillance system in White Mountain Apache?
Yes, we'll go ahead and get started.
Sure.
And okay. So the White Mountain Apache tribe constructed a suicide data surveillance system in 2001. But I'll go ahead and go over where the tribe is located, some information. So we have, on here it says we have 15,500 enrolled tribal members. We have a little bit more tribal members than that. We have 17,000 enrolled tribal members. We reside on the Fort Apache Indian Reservation. Our reservation is 1.6 million acres. We're geographically isolated. We have a spectrum of traditional and mainstream cultures where about half of our tribal members still participate in the tradition and the culture and continue that with their kids. We are governed by the Tribal Council, which is 11 delegates with 4 districts. We have over a 30-year relationship with Johns Hopkins University Center for American Indian Health, which started in October of 1979, pertaining to diarrhea and dehydration and infant mortality. We have a variety of different programs and services that we provide on the reservation through Johns Hopkins University: infectious disease, behavioral, and mental health and training programs. The history with Johns Hopkins and the tribe has started in 1993 when the tribe was working to seek support and guidance in the community. So the community the initiative to prevent suicide prevention has been going on for over 20 years. And during that time frame, the tribe worked with a variety of different departments and agencies and different funding sources to come up with ways that we could help with suicide prevention, suicide intervention on the reservation. In 1993 to 1998, the Tribal Police Department, along with the Bureau of Indian Affairs Investigation Department, applied for a grant to see if they could hire community members to work with individuals who were struggling with suicide. And so they came up with a group of elders who were named by the community as the Ghostbusters to go out and meet with community members who would present either at the emergency department or through the dispatch where they were needing assistance with suicide prevention. And so the Ghostbusters worked in that sense, where they would go and meet with the people, but the police department would work with the elders, and they would be assigned with an officer to go into the community to provide these services. In 2001, the tribe passed a resolution mandating reporting on all suicidal behaviors. 2004 is when the surveillance system, the actual database, was established with funding from NIH through the NARCH program. And then community intervention design and implementation started after that, along with evaluations. Seeking guidance and support in 1992, community members in White River and City Q met with tribal leaders to figure out what would make the most sense for the community to move forward on working with an outside entity to address the suicide epidemic on the reservation. Tribal members and tribal council meetings met, meaning that tribal members went to the tribal council and shared their frustration about nothing being done pertaining to the suicides that were taking place on the reservation. And so the tribe started looking for funding to see how they could address these issues. And then tribal council and health authority worked in supporting ideas and any programs that were going to be implemented with their ideas that they had. And then tribal council and health authority requesting for assistance from Johns Hopkins University to help to come up with assessments and surveys to help us better understand what was going on in the community and to see what exactly the needs assessment would look like, and then what type of services could be implemented during that time. So the implementation of the Ghostbusters, like I said earlier, was established on outcomes from some of the assessments and surveys that took place. The police department, seeking the funding for this group, worked really hard with the elders to help train them on how to meet with individuals, but also to understand, the safety requirements as, an elder in the community. And then the Ghostbusters mainly consist of elders, and they provided guidance and support. And a lot of it was mainly, more of the listening portion than anything else for community members that they met with. The tribal mandate in 2001 took place when community members went before tribal council. We had 11 deaths by suicide in 2001, and the community was just pretty much tired, and they were done with the number of deaths that we had. So the tribal council formed the suicide task force. The tribal mandates the suicide surveillance system and registry system were formed through the tribal mandates. The first tribal registry, forms that were done was just with paper and pencil reporting system where you would get their name, their date of birth, their home location, type of suicidal behavior, and if alcohol was involved or not. And then hopefully hand it off to somebody who was a part of the suicide task force to do follow-up if they had the time. They were a part of most likely were working for another department, and financial resources were not available to support additional staff in going out and doing follow-up visits with individuals that presented. And so the suicide task force received funding for 1 year to do follow-ups. During that 1 year, we saw a decrease in suicidal behaviors on the reservation because of the outreach that was being conducted, but the funding was only for 1 year, so it didn't really help in sustaining that. The surveillance system was then formed in 2004 until present, so we still run the surveillance system, so that the tribe partnered with Johns Hopkins to launch the new project. So we updated and computerized the registry system. We worked on developing a follow-up form that would be conducted with all individuals who presented with suicidal behaviors. The Celebrating Life program was specifically designed to work with youth who made an actual suicide attempt to better understand why they were wanting to take their life and what other resources were available for them. We also worked with identifying community members who would serve as our case managers and aid in the referral for suicidal individuals on doing the follow-up system with them. In 2006, the tribe and Johns Hopkins partnership expanded with applying for funding through the GLS funding opportunity that came about with the grant. And during this funding period, we were able to design and pilot a prevention intervention program with information from the surveillance system, looking at 3 tiers that we looked at: universal, targeted, and selected. And this just goes over some of the statistics with American Indians and Alaska Native youth health disparities, and it just shows you for this that we received from the CDC. And then for suicide, it says it's 5 times higher than the national average. And this is for youth, and it gives you the age range for a couple of them. So Apache youth in the early 1950s, we had very low suicide rates prior to the 1950s. And then we had a few, but from the 1960s up to the early 90s. And then in 89, 90, all the way up to 93 is where the suicides really spiked. And we had a lot of deaths by suicide during this time period. And Francine and I were in high school during this time, and we also experienced some of the loss of suicide with some of our friends that we went to school with who took their lives. And so in 2001, when they established the Suicide Task Force, Johns Hopkins was also asked to come and, just sit in on the meetings and, make referrals if we needed to based off of the programs that we work on. And so phase one of the suicide surveillance system was working with the hospital on coming up with a form that made the most sense in identifying individuals who had suicidal behaviors. And so through the tribal resolution, the mandate that took place in 2001 and then was revised again in 2006 was a mandate straight across the reservation where everybody was mandated to report suicidal behaviors to a centralized location, which was to the Celebrating Life staff. And so when this information was being reported to the staff, they would collect the information, get the demographics on the individual that we had suicidal behaviors on, and do a follow-up with them. So our yellow form is the referral form. It's the Celebrating Life intake form that community members fill out to report individuals that have suicidal behaviors, or the self-reporting form. So they can do a self-report, or they can report on, others having suicidal behaviors. The pink form was designed for staff to do follow-up visits. So we had clarification on whether the individual's intention was to die, or if their intention was to, seek attention because they were struggling with whatever was going on. And so it was just allowing us to better understand what was going on with individuals in our community on how we could work with them. And so the case managers would do the follow-up visits, and we were also, part of the resolution is mandating all of the yellow forms that we received. We were automatically mandated to turn around and refer them back to Apache Behavioral Health. Once we did the referral, once we did the follow-up visit, we would check with them to see if they needed transportation to get services, or if there was another department that they would prefer to receive services from, and try to connect them to those services as well, so helping them identify resources within the community. So this is the yellow form that Noveline was referring to. This is the referral form that anyone within the community can fill out and submit to our staff. It's just a small glimpse, but this is the referral form. The next slide shows you the follow-up form. This is just the front page, and this is what the staff used to verify the information that was given to us based off of the yellow referral form. As you can see, based on our staff being able to enter the data and track what is going on, you can see that both American Indian males and females have the highest rates of all the ethnic groups that are listed. For the White Mountain Apache, as you can see, compared to U.S. all races and other American Indian, Alaska Native, White Mountain from 2001 through 2006 is 4 times the U.S. average, and then 13 times the U.S. average for individuals ages 15 to 24. Completion methods, so this just gives us an idea of the method that individuals are using, and as you can see, hanging is the method that majority of the people are using in the community. And when we compare our rates to those of the general U.S. population, you can see by age group where our spikes are. The highest is between 15 and 19 years old, and then our actual death rates are between 19 to 24. So as you can see, our Apache youth suicide rate is 13 times the U.S. all races and 6 times the American Indian, Alaska Native rates. Our highest completion rates are between 15 and 24, and the highest attempt rates are between 15 to 19-year-olds. The male to female ratios for completions is 6 to 1. It's actually gone up a little, and the attempt rates are 1 to 1. Again, 80% of the deaths are by hanging, and the triggers that we have identified that are most common are conflict with a partner, or close relative, loss of a loved one, or substance use. So some of the results based on information we've also collected from our community stakeholders is why is hanging the method of choice, and it's not disfiguring, shames the finder, it's silent, it's contagious, and they feel that a lot of the males are losing their traditional roles, females' possible role of abuse, and there's just other items that they've listed there. Thank you.
Great. Thank you, Francine and Noveline. I know that you guys are also in the process of doing some rigorous evaluations on some of the other components of your project. Are you finding that some of the data based on the implementation of the surveillance system and the projects that you have been implementing on White Mountain Apache are actually making a difference in regards to the numbers that you presented?
Well, one of the findings that we were able to analyze based on the surveillance system is that we have more reporting. So we probably receive over 525 referral forms a year. But it's gone up, but also the education that there is a referral system, people are more aware of it.
Mm-hmm.
But one thing that we've also been able to notice is that the actual attempt rate has gone down and the number of ideations has gone up, meaning that individuals are saying something before they're actually making an attempt, which is a good thing. They're talking about it rather than acting on their impulse of trying to take their life.
Great, great. Okay. Remember, please, that one of the things that we do have available for attendees is the chat room. So during the presentations, if you have questions and you're really wanting to ask them, please put them in the chat room so that we can go ahead and make sure we ask those as soon as the presentations are over. We don't want to lose any of that rich information. Eleanor.
Hi, can you hear me?
Hi, are you ready?
Yes, I am. That was quick. I wasn't, I was thinking we had 2 other presentations. Okay, hi everyone. My name is Eleanor Nault from the Chippewa Cree Tribe, Rocky Boys Indian Reservation from Montana. And I noticed we have a local in our group, Susan Hale, that is also from Chippewa Cree as an attendee. Hi, Susan. I'll go ahead and start my presentation. The goal of the code project that we had implemented several years back was designed to address the efficiency and the effectiveness of the juvenile justice system. While we addressed the adult system as well in the process, but we've primarily focused in the juvenile justice system. And through this process, it demonstrated that communities can improve their systems without sacrificing public safety, and that's kind of what I wanted to cover in my presentation today, is to kind of let everyone know that developing codes to reduce detention or to reduce the use of jails doesn't necessarily sacrifice public safety. So what we did was we restructured some codes, some policy and procedures, and we wanted to create a court system or a justice system where we made improvements that reached far beyond detention alone. Throughout the entire process, it required community collaboration. And what I wanted to make sure that everyone understood is that all voices or all community partners were very important to this process. All of the relevant local, state, and federal partners were invited to participate in the training process. And we actually requested some technical assistance from many partners through the Bureau of Justice Assistance, the Office of Juvenile Justice and Delinquency Prevention, the Montana Board of Crime Control. What I found is that almost all of the federal and state agencies that we reached out to provide free technical assistance. So we were very fortunate in doing that. And what we wanted to do was develop a therapeutic code. And it was a 5-year process, our 5-year strategic plan that was developed through a collaborative and a very highly participatory process that included anyone wanting to attend to provide their input and to assess and confirm the major directions which we were going to identify in the process. And it was to implement all of the goals and objectives through the strategic planning. The purpose of the planning was to ensure that the strategic plan was developed around a shared vision and to ensure that the plan was effective and that it would carry out through the entire 5 years. Discussions surrounding the strategic plan provided not only the councilmen, board members, administrative, and program staff with a framework to examine the current environment facing not just the tribal courts, but the community and the justice system. And it also had the opportunity to jointly identify the elements that would guide the efforts of all those that participated in the planning. Throughout the strategic planning process, everyone identified their expectations, and a lot of them included reviewing shortcomings, seeking out solutions, specific strategies for each departmental goal, to establish a good direction, define a roadmap to gauge how we got there, take initiative, assign duties equally, shared organizational values, shared perspectives, and we wanted to make sure that we recognized and respect others' opinions, to have open and honest communication. Stay positive was something we wanted to focus on as well, and to think strategically, because traditionally the tribes resolve disputes and address criminal activity by consensus, and it was not always an adversarial system. While tribal courts possess traditional methods of dispute resolution, there are formal court institutions that have been relatively recently developed in Indian country to be more therapeutic, and that was the direction we wanted to go. And some of the partners that we partnered with, and I mentioned earlier, was the Office of Juvenile Justice Delinquency Prevention, Tribal Youth Program, the Montana Board of Crime Control, and E. Casey Foundation was huge in this effort because they were also able to bring with them the Association of American Indian Affairs and the Indian Child Welfare. And then we also brought forward the National Council on Crime and Delinquency. And all of these are huge partners, not just in the state of Montana, but national projects or national organizations. And so we reached out beyond the reservation. One thing that I did not note, that when we did reach out at the time when we were requesting technical assistance, is I was told that it was the very first time that the Bureau of Justice Assistance, the Office of Justice and the Office of Juvenile Justice and Delinquency and Prevention, and the Montana Board of Crime Control finally all worked together on one TA. And I think the reason they did it in the past is because they serve such different populations. Like the BJA, Bureau of Justice Assistance, primarily focuses on adults. They do serve some families and youth projects, but most of it was adults. And then, of course, OJJDP focuses mostly on youth. And then the Montana Board of Crime Control kind of focused on everything. And so it was very unique that we were able to bring all of them together. And then, of course, our local partners included the courts, law enforcement, social services, Boys and Girls Clubs, schools, TANF, and the Chemical Dependency Center. And one thing that we also included was our local external evaluators who evaluated the majority of the programs on the reservation biannually or annually. And we always used those evaluation recommendations or findings in the programs to evaluate whether or not we were being successful or not. As part of the project, we developed policies and procedures to assess youth at various points of contact in the justice system. Immediately upon contact with the law enforcement, our youth were given an assessment. And I'll go into more of those assessments in my presentation. And then prior to a preliminary hearing, they were also evaluated, and prior to an adjudicatory hearing. A preliminary hearing is when they very first go into court, something similar to an arraignment as an adult. And then their adjudicatory hearing is when they're giving their sentences for if they pled true or if they were found guilty of a crime. And then while they were on probation, they reassessed the clients within 3 months. As I said earlier, the code allowed us to include assessments, and the risk assessment instrument was one of them, and that's probably the one that I am most proud of because we were able to convince our local police department and our probation officers that sometimes youth were unnecessarily detained, and it was majority of the time was because they couldn't find the parent. And we implemented this particular risk assessment based upon the Juvenile Detention Alternative Initiative findings. It was an assessment that was nationally used, and it was a point system that helped us determine whether or not this youth should be detained, or if they were truly a public safety risk, I should say, and needed to be retained. The risk assessment is a written checklist of criteria that are applied to rate each minor or each youth for specific detention-related risk, because we all know that when youth are placed, or anyone is placed in any type of secure confinement, their risk for suicide or mental health problems increase. And the overall risk score is then used to guide the intake officer or the probation officer in making a critical decision whether to detain the youth or release it to a parent or guardian. Then, of course, there's the informal process. As part of the initial code, we actually wrote this into the code. For all first-time offenders, they were referred to an informal process rather than having to go directly into the court system. At this point, a prosecutor would review the initial complaint and would meet with the public defender or with the youth, and an informal agreement, a youth and parent, and an informal agreement is recommended to the youth, the public defender, or the counselors involved with the youth for first-time offenders. Once it is decided that an informal agreement is necessary, a notice is given and all of the relevant partners come together, and if the youth decides to plead true to the charge, then conditions are set, and it prevents the youth from going and getting stuck in the court system, because a lot of times what we found is that once the youth were in court, or if they were charged in court, once you get into court or the justice system, as a youth, it's very difficult to get out of it because of various circumstances for the youth. So we tried our best to try to keep the first-time offenders out of the system. And then, of course, we developed alternatives to detention, and one of the successful stories as well was the Healing to Wellness Drug Court. The mission of the drug court program was to bring together community healing resources, and all of the departments that I listed in the prior slide for the courts, law enforcement, social services, Boys and Girls Club, schools, TANF, and Chemical Dependency Center would come together and using a team approach to achieve the physical and spiritual healing of the participant and the well-being of the community. The primary purpose of the drug court was to provide intervention and treatment for offenders who wanted to make positive life changes and to break the cycle of addiction. And of course, if for some reason the youth and the parent decide not to go into alternatives to detention or healing to wellness, then there was also probation. And all probation clients were assessed and a case management plan was developed. A very comprehensive case management was planned. And the assessment was a supervision strategy that weaved together not just the risk assessment, but a strength and needs assessment. It was designed as a one-on-one interview with the youth, much of which focuses on the underlying motivation for illegal behavior. This process puts workers in a more proactive position in relationship with the youth. It allows more communication between the probation officer and the youth. It's not just a check-in, I'm here, I'm okay, drug test me, I'm leaving. It's more communication where you're actually sitting and visiting, how you doing, after developing the case management plan, they would review their goals for the week or their goals for the month. Did you accomplish your goal? If you did, how does that make you feel? Or if you didn't, how can we change it to where you're getting closer to meeting your goal? And this builds rapport between the youth and the worker or the probation officer, and it better equips the agency to leverage the limited resources of the time and treatment programs. And my last slide is I wanted to give you some results of this process, which was a very long process. Like my introduction, they introduced me working in the court system for 7 years, and then with the JDAI for 4 years. It was a very long process. It didn't happen overnight, and it took a lot of team efforts, but the results were very promising, and we had some very successful projects. It decreased the number of youth that were unnecessarily detained or inappropriately detained. And what we found as part of this project is, and I know us as natives, sometimes we want to immediately say this is a race issue and that outside agency, whether it's white or non-Indian or some other organization, we want to be able to say, well, they're doing that because he's Native American. Well, this research actually showed our tribe, at least for this tribe alone, we're trying to implement it in other tribes right now because this was a pilot project. We were the first Native American pilot project for the JDAI. And we found that sometimes our Native communities are more harsh on our youth than our non-Native. And it was kind of hard for us to swallow. We had always thought it was another community being more harsh on our youth, where we found it was actually our own justice system, our own people. So that was a real eye-opener. So that really helped us see how we could change that. And then it reduced the number of youth who failed to appear in court or to reoffend pending sentencing hearing. We were able to get them back in the court system. It was more of a therapeutic process versus a punitive process. We were able to redirect public funds toward effective juvenile justice processes and public safety strategies, because sometimes we were spending so much funds housing them in detention or trying to employ more police officers or more prosecutors to keep them in jails and institutions, that we redirected those public funds, and it helped those families and them youth. And then it reduced the disproportionate minority confinement and contact of the juvenile justice system. Like I said earlier, we were able to show these results to other tribal nations and to show them that, yes, these non-native communities are harsh on our people, but we are also harsh on our own youth, and we need to be more therapeutic in our own system as well. And then the overall goal, which I believe we accomplished, was we improved the juvenile justice system. And that was my presentation. I hope I stayed within the 12 minutes.
Thank you, Eleanor. That was wonderful. So we're going to go ahead and now open up the lines and do about 15-minute question and answer. And so we know that today you've actually heard 3 very different approaches that have fostered partnerships of local leaders to address local problems. From the coalition development, which is a lot of what is currently happening, from tribal mandates all the way up to tribal codes. You know, it's a very big jump, and so we really wanted to bring about, you know, some of these different approaches, and we'd really like for you now to have that opportunity to ask the presenters questions. So if you need to unmute your line, please hit star pound. Again, that's star pound to unmute your line, and you can go ahead and ask and have the opportunity to ask the presenters particular type of questions about their presentations, or you can also use the chat if you feel more comfortable doing that. Francine and Noveline, we actually have one question already, and so since your presentation actually kind of mentioned the concept around hanging, I wanted to talk to you or bring this question to your focus. And it says, we can try to get the guns, but broadly in Indian country, hanging is a high frequency. How do we get the ropes? Are there cultural, I think that's ropes, are there cultural interventions that might directly address hanging? Have you guys on White Mountain Apache and Johns Hopkins, have you guys addressed that question?
Yes, we did. Part of the program that we worked on through New Hope, we asked the youth the youth that made an actual attempt on their life. We asked why their method of choice was hanging, and a lot of them would refer back to the fact that it's really easy for them to do. It's silent. It's very, you know, it's easy, and it, you know, it doesn't disfigure the body, and so, and that it's readily available. They can pretty much just use anything and pretty much anywhere. That's the reason why they said that that was something that they had thought of when they were making their actual attempt. And so it's scary to hear, you know, the youth talk like that about those items. And so when we have an elders council that we meet with on a monthly basis, and we address this with them about, you know, what we could do, you know, to talk about suicide prevention, also the high number of hangings that happen on the reservation, and, you know, how could we address it because they feel it's like they're desensitized to some of the stuff that they're saying and doing. And so it's really hard to comprehend someone's behavior at that time when they're wanting to take their life, because 80% of the individuals that do die by suicide on our reservation, alcohol and drugs are also involved. And so we know that some of them aren't thinking, you know, clearly, you know, with the actions that are taking place. And so it's not something that we have been able to easily address or focus on or get really deep. We've gotten the answer straightforward, you know, why they choose that method. But to address it culturally, it's been really hard for our elders to talk about it, because if somebody's drinking and using drugs, you can't, you know, pretty much compromise with them. So.
Okay. Are there particular interventions that you've used with the youth? I know that the elders are talking about it, but are there anything that you've been employing?
So when we've worked with the youth through our New Hope program and our Empowering Our Spirits program, we worked with them on developing life skills, with developing coping skills. so that rather than thinking about taking their life or feeling that there's no hope, that, there's other things that they can do, to look at the problem, identify what the problem is. Is it really a problem that is yours? Is it really as big as you're making it out to be? And then looking at the outcomes of that problem, what's going to happen, if they've gotten in trouble really bad, if they did something really bad, does it mean taking their life? Is that the only way out? And so having, teaching them to stop and think and to really, look at what they're struggling with and, to see that there is hope. So those are the lessons that we worked on with them through the different programs that we worked on, specifically with youth who've made an actual suicide attempt.
All right. Please remember, if you want to ask a question of the presenters, to unmute your lines. Again, it's *# to unmute. So is there anybody on the line who would like to ask the presenters a question? You can also put it into the chat if you'd like. Okay. I have a couple of people typing. I'm going to ask a question that came up while people are typing, and then we'll come back to that. This is all for all three presenters. What strategies have been successful in empowering sites or your communities to begin these discussions? So, any of you would be great to answer that question.
I think the strategy that we used was data. Sometimes if you didn't have the data available to really look at and to really dig in deep into the data to find out the number of youth that were arrested, the number of youth that were attempted suicide, the number of youth that are, how many days they were spending in jail, things like that. When you had hardcore data, that was very, very important for us to look at and to see. So it was no longer a guessing game. It was actual factual data. And we were able to see it over a very long period of time. We collected it on a monthly basis and continually collected it and looked at it and really dug deep into the data to find out what was happening and why it was happening.
Mm-hmm.
And the assessments were very, very an eye-opening as well, because the assessment that we used spit out another report that allowed us to see the overall needs of our community as a whole, not just for the individual themselves, because we did the assessments with the youth and the adults, but those online assessments would immediately spit out a report for the individual and for the overall. Like if we assessed 100 youth or 100 adults, it would compile that information for us to see where our gaps in services might be or what needs were. Where was the majority of the concerns? Was it because they didn't have a job? Was it because they weren't in school? We were able to look at that approach as well.
Cora, you guys' project is, really focused in on a coalition. Was there any particular strategies that really helped with getting the conversations going with the coalition?
With the coalition, well, many of our experiences are out in the community because we promote the suicide prevention education, and it's our community events, our culture events that help, with the youth, because it's a structured area where we have, where some of their parents are involved.
Mm-hmm.
So with that prevention, having family involved prevents the ideations or attempts, or bringing a family close together has helped. through the coalition, you know, these are reported into to the coalition, and you know, and then it's talked about there. But there's other issues too that come about when, like when an individual is jailed, when a youth is in jail. You know, we don't have a juvenile detention center here on the reservation, so they're sent off the reservation. But we do have our jail that was remodeled, and they just had a grand opening last week sometime, but you know, that doesn't help a juvenile because you know, that attempts, you know, because they have to send them off the reservation to get help.
Yeah.
We don't have a hospital here, so it's kind of. But mainly I see is our culture events, you know, helping the youth because they look forward to that, you know, that togetherness. So that has helped our community.
So you feel the cultural events are opening up that discussion with families and across kind of along the lifespan about kind of moving this to be more embedded within the tribal kind of tribal way of doing business on an everyday basis.
Yes, you know, because we don't have a suicide prevention code in the Law and Order Code book. You know, we understand the importance of the community-based code development. It is essential, and it is important that the community be aware and buy into the laws that are going to be bound by it. When the community has a voice in the code development, they are far more likely to abide by the laws.
Mm-hmm.
And it is also important that tribal codes provide mechanisms for tribal courts to assist families when mental health or substance abuse is present as a means to not only safeguard the larger community, but to also provide assistance and support to individuals and families in need. But, you know, it is critical, a critical component for preventing suicide. That is, it enables families to assess the services they need when problems are first presented. Um, and the Spirit Lake has a civil mechanism in place through the civil code that enables the tribal judge to order an individual to be placed into protective custody or to be civilly committed of evaluations, demonstrate a need for services, and it is critical as many people who are in crisis are also in denial.
Yeah. So it's really important to really review those statutes that exist for children and for detention for police officers, and thinking about suicide prevention as you do that to really kind of ensure that that's available. You guys have done an awesome job with that with your coalition, and actually Pat was just making a comment on the chat about that.
Yeah.
And she said that, you know, that it really highly engaged the coalition members to critically look at the crisis response plans for the Look on the Wahitika project. And, you know, I know that there was a lot of work in regards to revising stuff and really looking at policies and procedures that the police department had, that the EMS department had, and everybody else that you mentioned in your presentation to do that. So, but, you know, I just think it's great that you guys did that project.
Including the traditional services and practices which are important for the inclusion is culturally appropriate response to suicide prevention and intervention. So,
yeah,
you know, it is really, really important that we have that culture component in there.
Great. Somebody was speaking.
This is Eleanor. One thing I wanted to mention as well is what we did, and it was several years back, so I thought, well, I didn't remember it until he just mentioned it. It hit on, I guess a light bulb went off, is we actually even changed the name of our code. Before it was Juvenile Code, and just the name juvenile kind of set a negative or a punitive name to what was happening. So we changed it to a children's protection code. So we kind of just even had to look at it that way, and we wanted to stop referring to them as juveniles, but as children.
Yeah, really changing that conversation within the tribe even.
Yeah.
So, Muscady, did you have a question? I saw that you were typing. Okay. Well, we have about 1 minute left. Well, we have about 2 minutes left, actually. So does anybody have, oh, okay, there's a big, long question here. Says, I'm aware of some tribal traditions that believe that individuals who pass away due to suicide require a specific ceremony to make sure that the spirit is able to get to where they are going. Has anyone utilized ceremonies such as these for community healing? An elder from South Dakota explained this to me as saying the ghosts of people who pass away from suicide need to be taken care of in a good way, so they, spirit of person who passed in this way, is not encouraging others to do this. Is there any other presenters who want to talk?
Yeah, that's, this is Cora. My youngest daughter, Jamie Jetty, she ended her life by suicide when she was 14 years old in 2008. And, and what helped me is through our tradition and having to go to a sweat and, and the medicine man from South Dakota bringing her in, and that's how we got her message, and that's what I use when I go out, and I take her message out there. It's called Jamie's Message, and suicide is not the way to go. It's really scary. So I do have that on a PDF that I can send out to whoever wants to read it. Really important. It's very touching. And it not only has, her story, it has my story in there, how I received her message, and there's other things attached to it that explains. But what I like doing is when I present that is explain the pages that we have in there, because there's so much meaning in the pages, not only through the church, but, through our traditional ways, and how I received her message. And her message is out there, and it's helping people. I had several people tell me that she has helped them, because of where she's at now on the other side. So just like, I don't like to say too much of that, because of some people don't believe in our culture and believe in our ways, then I don't say too much of that unless, they read her story, read Jamie's message, and then I can answer questions that they might have.
Thanks, Cora.
Okay. Well, this is Courtney, your Holler, and it looks like we're at our time. Before we wrap up and hang up and everyone goes their separate ways, first I want to say, I want to acknowledge and say thank you, Cora, for sharing that last bit there, that personal side. And I know we all have our different stories or different reasons why we're here and what different paths that brought us to this point to do the work that we're doing. So I just ask that I'm going to say something short to our creator here, but just to acknowledge that. And then and also I want to remind everyone that this has been recorded, so this whole event will be available for you all to access to the SPRC website. Also, you'll be getting a short evaluation, an email with a click on to access the evaluation. We do appreciate your feedback so we can continue to develop these webinars and these times together so they can be fruitful for all of us. But with that said, I just want to say thank you to all of the participants, the presenters, and everybody for their time. And at this time, we'll go to our creator, and then we'll just close it out that way. So, Wahayati Hadam, we thank you for this time, this space that you provided for us, and the paths that you brought us to this point. We ask for the strength to carry on and to collaborate and to strengthen one another, be with the friends, the families, those that might be on our hearts and our minds. And all this we pray, amen. Thank you all for joining, and you have a good, enjoyable day.